FirstHealth started looking at our community health needs assessment data, and we had data from 2003 and from 2007, and we had noticed that the diabetes prevalence rate in Montgomery County was double that of the state, and the mortality rate was also double that of the state, which was a little more alarming than, say, the prevalence rate. And at that point in time, we had completely pulled diabetes education services out of that county due to fiscal issues with the budgets. And we realized we were expecting people to come to us, and that simply wasn't happening, and people were actually physically dying of diabetes complications. So we realized that either people were being diagnosed late and they had too many complications, or they weren't being intervened with or getting linked to care, even though the prevalence rates were higher. So we decided to develop the program, which we refer to as First Reach. And First Reach worked very purposely, very slowly, very deliberately. We started out with outreach and education, and then we began to ask ourselves, how do we merge this with the clinical? So trying to take that model of prevention through the clinical aspect as well as the community outreach aspect and joining those two together. So we went out and we started with the screenings and just doing screenings in places where we could catch people where they might not be suspected. So we went to banks on Friday afternoons when people were cashing their checks. We went to high school football games. We went to Walmart on Saturdays. And we were able to find people who were walking around with diabetes and didn't know it and link them to care, and that's where we began to think, okay, now we got them in primary care, but we're still not offering a formal diabetes education program. So we started to leverage some funding to put certified diabetes educators into the clinical setting. And when we did that, we realized that we were taking away the barrier for the patients to go that extra step to get the education. So they were getting education, plus we realized the providers were benefiting from having a certified diabetes educator in the office and helping them with their knowledge of diabetes. So when we received the news of the NOVA Award, we let our Chief Executive Officer know, our CEO, and he was very excited. But I think one of the aha moments that we had in the healthcare system was this program was run through our Community Health Services Division, and we were asked to present the NOVA Award information to our Board of Directors. And the Board of Directors looked and they said to us, one of the comments, "You have the answer. You know how to do population health management. You've been doing it. You know how to do this." And we properly answered yes, and we were very excited to be recognized.